taking you guys through the process. You see, if I did school, they work. Can't one help you go school. I beg, make you read your book. Hey, Sam, it's still early. People are sleeping. But I still have some certification I need to get. See me go to school. I beg, Mokona read na book. No say the woman get money in America and then for the do all this thing. I beg, Mokona read na book. So that all of us go make this money. I want all of us to make the money. I beg. Mokona read na book. Oh. Now read that book. Make all of us make this money together. As you can see, it is late. It's early. Well, you have to be up from bed. You have to be up from bed. If I'm doing this to help you, you should read. Good morning, guys. You see, that's how they hustle here, right? See, so you see, people are still sleeping. I'm off to school. At school, so I dey go by this time. Make I carry una go. Make una see time. People they sleep. See, at school I dey go like this. My school is just 6 minutes away from my house. Not far, but at school I dey go. See time. See time. See time. Then I dey see. The motor won't enter, so enter my car to go school by this time. Eh? Open car. Then they say it's not easy, but we gotta do what we know how to do. So let's go ahead and go like this. Look my bag. Oh my goodness. See, let's go ahead and go like this. So it's early, but I have to go. Eh? I'm gonna read on a book. Oh. I want to be a nurse. I want to read your book so that you can make the money.
Also called the recovery period. This recovery stage lasts around 2 to 4 hours after birth, and at this point we encourage skin-to-skin and breastfeeding for multiple reasons. Now, breastfeeding stimulates maternal oxytocin release, which helps contract that uterus. It provides nourishment and supports the blood sugar of the newborn. Now, be sure to write this down. Assessments for the mother. We put priority on blood loss and infection. So when it comes to infection, a temperature over 100.4 requires further evaluation. Now, having a slightly elevated temperature in the first 24 hours following delivery is a normal physiological finding. Now, moving on to hemorrhage, especially if the mother had a complication related to a lacerated birth canal, which is basically the tearing open of the tissues. So write this down. The priority assessments here include monitoring the peri-pads. Remember, peri-pads are priority. The key term is fully saturated in less than 1 hour. Many question banks had different ways of saying this. For example, 1 pad in 15 minutes or 1 pad every 5 minutes. We also want to monitor for a decreasing blood pressure and an increasing heart rate, as these both indicate severe hemorrhaging.
What was the color of the fluid? Yes, remember, color is critical. Meconium stained fluid, that dark fluid, is a very bad sign, indicating risk for fetal distress, hypoxia, and even a big aspiration risk. Next is, what is your expected due date, the EDD? Also called estimated gestational age. Remember, preterm newborns are considered less than 37 weeks gestation and are at the highest risk for respiratory distress after birth, as the baby's lungs are not fully developed at this point of the pregnancy. And we also want to ask, how many babies are you expecting? Because preparing for multiple newborns requires more staff and more resources. Another answer option is, do you have any active sexually transmitted diseases? Since this would indicate if a C-section would be needed if there's an active STI. For example, active herpes if there's an active outbreak. And very lastly, recently, have you taken any medications, opioids, or illicit drugs? As certain medications and drugs like opioids can cause respiratory depression in the newborn. So remember, Opioids make the vitals low and slow. Then moving on to the third stage of labor, the placenta delivery. The uterus contracts and the placenta slowly detaches from the uterine wall. Now the placenta must be carefully delivered. Never pull on the cord to deliver the placenta, as this can lead to a high risk for tearing the placenta and leaving behind placenta parts, and even possible uterine inversion, where the entire uterus flips inside out, both of which put the patient at high risk for hemorrhage and even infection. So remember, the client is at high risk for infection if placenta parts are not fully removed from the uterus, as well as uterine inversion if there's pulling on the cord, which can lead to severe hemorrhage or that bleeding, and increasing blood pressure and increasing heart rate. So the longer it takes for placenta delivery, the higher the risk for hemorrhage. Pharmacology after placenta delivery. Just think of the double P's here. P for placenta delivery, we give P for Pitocin or oxytocin to prevent hemorrhage. So remember, the key point is oxytocin stimulates uterine contractions. So just think of the C in oxytocin helps the uterus to contract. So the ATI question, the third stage of labor. The baby has been delivered and the mother is now delivering the placenta.
Imagine turning a simple 20-minute video into over 250,000.
Women, now because of when they make this video, you see, learn not to listen to some certain people. I know a lot of women, even back then at home, they do all this way they deceive themselves, which is they do press. And why a lot of people they fall those victims because you like to listen to nonsense talks. Those women, what I want to talk about, they even spend past their husband for house. They pay rent, they feeding, they share. But they'll come, they deceive you. They tell you, say, oh no, men are supposed to do this. Men, no, me now, my husband, they pay rent. Me now, no, I don't do anything, no. He pays my car insurance, he pays the rent, he pays the children's school fees, he does everything. My husband, he doesn't even ask me about my check. Run for women where they can't tell you those kind of stories. They lie. Women where they can't tell you those kind of stories, they lie. This country, everybody they pay bills. Everybody. Except the man that man they do. Now he be saying you and the wife go they work 12 hours work. He pays the bill, he does everything. I know they talk with her, no. I know none of those kind of men that exist to America here. So women, stop allowing your fellow men to deceive you. A lot of homes don't go down today because of all these kind of things. It's unfair. Hi, good morning, parents. Let me quickly say that. So I got a lot of message on my DM, people asking, oh, now true say if you beat your pikin for America, say police go arrest you. It's a lie. Now true say if you shout for your pikin head for America, police go arrest you. Don't let anybody discourage you. Those things are not true. You know, now those things me I even hear when I did Nigeria. Say if you beat your, not beat them when you go America. It's a lie. Nobody they can't arrest you say you spank your pikin. Nobody they can't arrest you say you correct your pikin. I'm not saying can't take cutlass not pikin for head. I'm not saying oh stone them. You know those. That's not what I'm saying. What I'm saying is that people discipline their children. Like me when my pikin do anything, I tell them in either. Right? Yes. When pikin do anything, you correct them. And this is another thing. When you're correcting a child, let that child understand. Let that child know why you're doing that thing at that moment. Now you understand, so that the pikin self go get them for it. Say, oh, this thing why I do no good. Oh, anytime I remember this healthcare job, I just laugh. You see, this healthcare job is not for everybody. Well, lie is not for everybody. It's for those who are very patient. Healthcare job now for people they very, very patient and then fit do this job. If you know they're patient, you know fit one. Because this is how you work. They give you one person, you work with the person, 2 days, the client tell the company, say they don't want you again. The company carry you go another place, they tell them maybe after 1 week, they say they don't want you again. They carry you go the top place, they say they don't want you again. That means you're not fit for the job. Because everybody can't just be rejecting you. And these people, they feel just look you finish like this. They just hate you. But you know sure and say they hate you. Do your job. Do your job. You know they buff anybody. As a caregiver, you know they buff anybody. As a caregiver, you know, some of them they misinterpret caregiver, nurse, and IHSS, right? Like I said before, the IHSS, their job now, the in-home support service. Okay, the IHSS now then they come house, now then go ensure say the client food, where the client won't eat, and then go ensure say that they go store for the client, do the shopping and all that. The IHSS, they're more like a family member to the client. Then you as a caregiver, you're just there for companionship. You just did it like that with her. You want on television, you on television for her, on news, as in put on news for her. You understand? You are not his nurse. Then the job of a nurse there now to give her medication, right? Give her medication. So there are three things. Some of them they get these three people I call. One person if he get IHSS, he gets get nurse and get caregiver. So everybody gets their own way they do. You understand? It's not easy, but it's doable. Be patient. I don't have more to say today, but be patient. If you're patient, you will enjoy it, you will make the money, you will cash out. You go cash out if you are patient. If you are patient, if client like you, come rain, come sun, the company won't come out to you, they no go fit because the client like you. How client go to like you? By you being humble. You have to be very humble. You don't need to be rude. You know, we Nigerians, naturally, when we're talking this, we sound rude, right? But that's how we talk. You don't need to raise your voice. Now, so our voice. So when we talk, they say us to be rude people. So when with time, they'll understand. Say, oh, now so we talk. Oh, I don't know. She's shouting. She's yelling. That's how we talk, right? But with time, they go understand. Say, now so our voice. But which I they try to tell you, say, I see they talk about pain. Hi, parents. It's me, Jane. I'm back like I never left. Come close, parents. Let's talk today. Let's talk about sleepover. Let me ask questions. When you were in Nigeria, raised by your own parents, your mother, your father, right? Nigerian parents that I know. Do you go for sleepover then in Nigeria? Is it our thing? Is it our culture? It's not, right? Then good. Do you think if your children don't go for sleepover, does that mean you don't like them? Because you see that our children of these days, they really know how to blackmail parents by using words like, oh, you don't like me, oh, you're mean. Hey, don't care when they use words like that. Please try and raise your kids well. Going to people's house is not safe because you don't know these people. They are not Nigerians. Some of them are Nigerians. And I don't want to start calling colors or calling countries and all that. It doesn't really make sense. But you should understand what I mean. Allow your children to go to somebody's house to sleep. It's not good. These people are not like us. You don't know what these children do when they go there. Do you know in this country, America, you see children of 11 years on drugs? Yes, because most of their parents take drugs. And when our children go there, they see them and it's something else. I'm sure you don't want to regret raising your children in America tomorrow. You don't want to regret that, right? Because this society, they said America will raise you at the same time. America will build you. And if you're not careful, the same America will destroy you. These children, when they commit crime, they send them to jail. Guess who they blame? They blame the parents. The same society that tells us not to beat these children, right? Good. The same society will hold you responsible for those children. Please, parents, discipline your children doesn't mean you're wicked. At all. It's not wickedness. I'm not telling you to use stick or cutlass to hit your children. No. Please try and discipline your children. Sleeping out for me is a no-no. Make your house very comfortable for your children and they will stay. We don't do those things in Nigeria, not because we're in America. We see Americans doing it, we want to jump into it. It's not our thing. We don't do that. That's why most of us, our children will start coming up with different characters, different behaviors, and will be complaining. You don't see what they do out there. Please, let's be very mindful of where our children go. But for me, sleepover is a no-no. If that will make your son or your daughter see you to be a mean parent, it's fine. As long as you feed your child, you take care of their clothing, they go to school, they are very comfortable. If sleeping out will make you a mean parent, fine, please bear the name so that tomorrow your child don't disappoint you. Thank you for this. Please always share my video, like my video. I love you girls. It's Jane. Thank you. Hi, I beg, quick one. Oh. So I hear a lot of parents will say, no, they don't want to raise their kids the way they were raised by their father or by their parents, that their parents was too strict to them. I beg, Muna, help me talk. If he say, does that mean say when our parents that time they use hammer, they knock on our forehead? Does that mean say when our parents they carry cutlass, knock on her? Make her understand the strictness with the insane. Maybe strictness they not allow you to do some certain things because I know our parents were never wrong raising us, you know. But the way when they take talking like say, my own father was very strict, but I see they sit down with my papa. My papa they eat, you go remember food for us to go eat. No, I understand. Come up, say something to make sense to me. I don't understand why when they say when a parent they strict. How? Strict, how are you not eating? Didn't you go to school? Didn't they send you to school? Let me understand, because so that when they explain to these Gen Z children, we will know it till they tell them, because it's so annoying when I hear parents use the word, oh, I don't want to raise my kids the way I was raised by my parents. What were your parents doing to you? Say it, let's hear. Please. When I don't do, because of all these dirty statements that I don't feel raise children. Only this America. I not put time for America. I think this just parents on there. You have a 14, 15 years, 16 years old child, a girl cannot cook food because say they're America. You as a mother, you go work, come back. You can't cook food for 14, 15, 16 years old picking to eat. No, now. And what did they cause all these things? When I go they cook, children go they press phone. As these children, I don't want you stupid. As they rich, picking go they cook for you, with the mother, you go they gist you, go they cook food. You tell pikin to come wash plate, you go grumble, you can't leave and you can't go, you can't wash am. Oh yeah, or you no, or the one most of the one I know say parents do. No, I don't want you to waste my time. Which time? Make it waste time. If you take 3 hours to do am, make it do am. Oh no. You know what? Just leave that and get out of. No, don't go. Stay there and do it. Stay there and do it. No, they cause all these things. You tell her make it come do, I can't grumble because you know what? Just get out. You know go get out. You come there, come wash am. Make you come wash am. As you dey cook, make your pikin dey near you. You know me say that pikin go come marry one Oyibo man because that's all these parents and their mentality be that saying yeah they're in America, you know. No, you go jam one Nigerian boy, wait, you go jam one Nigerian guy one day and maybe the Nigerian person like African food, or even though you know jam Nigerian person, you can't meet person we like food, you go cook food now. No say oh I beg we will cook, we help, he help me. Because that's what parents say. We were on our way there train, he help us. Because parents say that I beg you, all the strict our parents strict to where we carry and go. Where you carry and go, you marry born pikin. If they're not strict to it, I mean for them like 4 or 5 house, you know we will know people born them. You know? So I beg. But I know they make all those stupid statements. My parents was too strict to me. I don't want to raise my children the way my parents. How they tell? Oh my God, it's just so annoying. I just saw something now and it's just very, very irritating. Some of, like I even speak pidgin, some of these are Nigerian parents. Now, they try at all. When I go pay ticket for Pikin, carry and come America, Pikin will come, they ride una, they control una. No good. Now they even give una children those chance. I come Target, come buy something, me and my son, right? So I can't see one Nigerian woman, like she hold 2 baskets. My son was actually holding one. I was holding one because we had like 2 baskets. So this woman dragged 2 baskets. Until the thing heavy, things where she carry kind of heavy for her. So she can't tell her pikin because say, she was like, can you help me hold one? If you see the way this pikin take shout for your mama head, when pikin don't come wear crop top inside coat, see the shout for your mama head, the mama shame catch the mama. Because I stand, I just tell the girl, say, I say your mom is talking to you like the way I want it. She can't, okay, she can't work, I go help her mama carry the thing. On the nag this, you know. So the mom, oh God. I can't meet the mom. I call her and say, but that's not nice. You know me. I know I go say, guess what the mom said to me? He say, you see these children, when they carry call, you know they had them call police. Which police they call for? Now they put those things on our children. Pikin where they live for your house. Pikin where they parent for, where they feed you. Now you even follow by the mumu crop top way where they can't call police on you. It's not done that way. What I'm saying is that now we parents, now they cause all these police things. You don't get them for head. Imagine what you they won't talk front of your pikin. They say, if you do, you pikin go call police or you which house?
Experience, and we want to get you to here. But because of all of you, many of you being in the medical profession, you're already like this. We're just going to do a little layer around it for the knowledge. Okay, I promise you. So you see what this looks like. So you wouldn't know unless you've done it, and I've been doing it.
Labor. So this includes vomiting, bloody mucus, and the urge to have a bowel movement. Now some interventions. Remember, the client is in extreme pain at this point and is feeling very anxious. So 4 NCLEX tips to go over. Number 1, emotional support and encouragement is vital. Secondly, we want to provide breathing techniques. Third is 10 centimeters dilated. We want to document the fetal heart rate every 15 minutes, as mentioned by Saunders. Last but not least, we want to avoid pushing until 10 centimeters, so that's the full dilation. If we push before then, there is a risk for cervical swelling and lacerations. Now for a top missed NCLEX question.
Hey you, are you still watching? Well, don't miss out on the rest of this video and
A laboring client reports anxiety, vomiting, and the need to have a bowel movement. What is the expected cervical examination finding? So option B is the most correct, as these signs correlate to phase 3, that transitional phase. 8 to 10 centimeters dilated and 100% effaced. So option A and C would be incorrect. Oh, and if you chose option D, then you bad.
30% less calorie. Oh, yeah, how could you? All right, now for the second stage of labor, the delivery of the baby. This is also called the descent phase, or the pushing phase. We're pushing that baby out of the birth canal. So the 4 key points to write down. Number 1, the cervix must be 100% effaced and 10 centimeters dilated. Remember, the key number is 10 centimeters. Once again, the memory trick here is the perfect 10. Number 2 is the signs. Increase in contractions and the urge to push or poop, basically defecate, which makes sense since we're using the same pelvic muscles that we use for a bowel movement. Now, a big key term here is the Ferguson reflex. This is the spontaneous urge to push during labor. It occurs when the presenting part of the fetus reaches the pelvic floor. Hello, is it me you're looking for? So, big hefty question here. The second stage of labor, significant increase in contractions, Ferguson reflex is activated, and the client experiences a strong urge to bear down. Now moving on to number 3, the interventions here. Remember, positioning of the mother is priority. High Fowler's, lithotomy, or sideline position. And we must educate the client to push properly, since the epidural may decrease feelings of contractions. So number 1, avoid holding the breath and tightening the abdomen. Encourage the mother to keep breathing. Number 2, push when feeling the urge. And number 3, breathe in deep and breathe out slowly through the mouth and keep the mouth open while pushing down. This is mentioned by Hesse to help increase oxygen to the fetus. Now number 4 are the assessments. These are more important during the second Hesse. So fetal heart rate before, during, and after the contraction. Frequency, duration of contractions, as well as uterine tone between contractions. All of these showed up on a few select all that apply questions. Now, speaking of select all that apply questions, a very tricky NCLEX question came up during our review. So a top missed NCLEX question. A client presents to the emergency department after her water broke. She appears anxious and in pain, bearing down with each contraction. What assessment questions should the nurse ask immediately to prepare for birth and potential newborn resuscitation?
So, we could,
Taking you guys through the process. It's not easy. See, it's early. We're still at school. We're on break. I beg. Read your book. Read your book. To make money for nothing. No easier, but it's doing it. People are doing it. Now say make I do am. See, say make I do am. The baby no get forehead. Why? All I need to do is to read my book. I'm encouraging you guys. Do it. Believe me, it's easy studying nursing in Nigeria than here. Right? Because here you have to work, go to school, right? In Nigeria, you go to school straight. So read your book.
And number 2 is left lateral position will not alleviate the client's back pain. This position is good for fetal oxygenation and blood flow, but not really good for back pain. Now for a Hesse question. Which supportive care measure for back labor pain? Lean over a birth ball with her knees on the floor. Now over to Barb for some top missed NCLEX questions.
First question, the client reports intense back pain and the fetal position is the right occiput posterior. Which intervention would help alleviate the back pain during early labor? The answer here is to apply counter pressure to the sacrum during contractions. And question 2, an appropriate task to delegate to the unlicensed assistive personnel or the UAP. And the answer here is to reposition an unmedicated client who is in active labor onto a birthing ball. Remember, the key term here is unmedicated clients. Now, do not let the NCLEX trick you. Nursing aides, those UAPs, can help with position changes, although they cannot do assessments or reevaluation of client status. Okay, now that we covered the top tested info, let's dive into the details.
Thanks, Nurse Barb. Now, starting with the first stage of labor, this is the longest stage, typically lasting around 20 hours. So this stage is broken down into 3 phases. First is the early or latent phase. This is where the client is relaxed and contractions are mild. Number 2 is the active phase. This is where things get super serious. Breathing techniques are in full swing and the client is typically irritable. And the transitional phase is when the cervix dilates to that perfect 10. We see rapid, intense contractions, often with vomiting and an urge to poop, with intense moans and groans. Often the client is saying, "Get this freaking baby out of me."
I love Monday.com.
What's Monday.com?
You don't know Monday.com? This is Monday.com.
Remember, stage 1 begins with the onset of labor and ends with full cervical dilation at 10 centimeters. Once again, the perfect 10. So let's dive into details of phase 1. So remember, phase 1 is that early or latent phase. And a quick test tip here. Don't get bogged down by all the numbers just yet. Focus on how the patient is acting and presenting, and what her needs are going to be during this phase or stage. So with the early phase, think we must give mom early education and encouragement. And the cervix is 0 to 3 centimeters dilated. Remember, the baby door is opening up in that dilation and becoming 0 to 30% effaced. We have a thinner cervix here. Now, this is the longest phase for first-time mothers. Now, as the cervix begins to stretch, it triggers oxytocin release in the mother's hypothalamus and posterior pituitary.
Or a suppository of hormonal, and we'll put that into your vagina and we will get the cervix ripened and we'll induce you. We might start pitocin to get those contractions going. I'm inducing her. Augment. She's 5 centimeters dilated. 2 hours later, she's still 5 centimeters dilated. The doctor, the obstetrician, will prescribe pitocin to help that labour along. Okay, help that labour along. And that's it. That's the kind of first little bit. Did you guys want to break now and go get some caffeine, or do you want to break at 8:30? What do you feel like?
8:30.
8:30. Okay.
I have a question.
Yes.
Maybe they used a balloon.
Yes, so what they're doing is they thought they would stretch your cervix. So thank you for sharing that with us. Yes, they can insert a little balloon and they just keep puffing it up and stretching the cervix. And by doing that, they're stimulating releasing hormones, and that should put you in labour.
Oh.
May I ask you if it did?
Yeah.
It did, it worked. So they bite, stimulating the cervix. Yeah, it did that. That's brilliant. Either a pessary or that's probably better too, it's a bit gentler. Then you release your own hormones. Yeah.
For augment, so the meditation is the same centimeters like for hours, and then that's when they.
See how many centimeters? Oh, so the same centimeters. Yes. If she's slow, I have a guideline of what I would like to see. Because if she gets stuck at 6 centimeters and never, she's going to get tired. The baby will get tired. So yes, augment is to help the baby along.
Like, and then we prescribe
A pitocin drip
and then induction is
to start her on labour, to get her going. No labor, no contractions. She's gone over her dates, and you know, so we want to start her off. We might even induce her if she has some preeclampsia. We might, but usually if you've got preeclampsia and the blood pressure is uncontrollable, we might want to do. Well, we would have to control the blood pressure before we took a C-section. What I'm going to do now is show you a video which will summarize everything I've shown with great diagrams. It's really great and it will just kind of help a little bit. We are going to go through labour on the video very quickly. It skims through everything and end up with the postpartum hemorrhage. But this is what I'm covering next week. What I want to say is we watch this quick video, about 20 minutes, and then we go for break. Okay? So this is a great video and it really explains everything very, very well. It goes over everything I've talked about, so you should have a sense of, you know, it's like a review of what we just talked about with diagrams, and I love this video. We also have the backdrop of the alarm to make things exciting.
That number now.
You guys see my class people.
So go back
We are on break.
WhatsApp.
See?
I now use my
So I try to take you guys through the process of our
ATM
school.
line.
See everybody
Then
here,
my
see.
normal ATM line now. Students in GM. That's why you get me another
So,
WhatsApp.
like I keep
The
saying,
web now is
nursing is
I
not
want to
easy.
catch that
See,
number
everybody here,
on my WhatsApp.
everybody here is working. We're all working class people. We are working and schooling. That's why I said it's kind of easy back there home than here. And what I'll say is that, like I keep saying, what we're talking about today is maternity newborn. That's what we're dealing with. So, they're showing us how to do it. You know, practical on maternity newborn.
You are looking good. Now how you are
Please, like I keep saying, nursing is one of the best profession. If you ask me, where you make money, it's, I don't know how to say it, it's a very good one. But let's do the needful. Read your book, I beg. If you want to make the money, read your book. Just read your book, you enjoy it. See, I try to take you guys through the process today. See us in school. I am still getting some certification on newborn, on maternity newborn, right? That's what I'm still doing. Biko, read your book. Nice school. Work in school. You see how school is easier? This is early morning. People are still sleeping. But you have to just wake up and go to school. For Nigeria, break me, you guys on your bed sleeping, right? But here, cool. That you make mommy proud, make yourself proud, right? I beg. There's a need for read your book. See, high school. That's what we're doing. See my students doing fun things. He's happy doing fun things. So they see them. Happy people. Read your book. Let me see what Natalia is doing. That's my favorite girl, Natalia there. That's Krista. Take see them here. For the people.
No, I thought it was because I didn't know. I'll try though.
Mr. Conte. Mr. Conte. In-law. Oh, school. It's not easy. see Mr. Conte. You, Mr. Conte, I see you, Mr. Conte.
We're not seeing the external monitoring. We're seeing very basics. What are we doing? We're going back to basics, right? Where that little trumpet she had to the baby, that's actually called a pinard. A pinard, and that is how midwives in Europe learn to listen to baby's heartbeat. We can deliver a baby without any tech. There used to be a time when we used to nurse without any tech. I go back to the dinosaur era, where we didn't have machines to count the drips. We had to have a little thing. If we get 150 drips a minute, that would give the IV would go through in a certain amount of time. Yes, I come from the.
No, okay, sorry. In that video, because I was just going by what you said about the little trumpet thing, it said it could determine how many babies are in the house.
Well, no, that's abdominal palpation. So if I feel this back here, and then I'm over here and I'm feeling another back, I can actually feel twins inside when I do an external abdominal palpation. Plus the size is usually bigger. Maternal, the bun height.
I'm like, how does that
No, that is just for one heartbeat, then move over here and get the other heartbeat.
Gotcha.
But ideally, I'll have a machine. But this is for women, and again, if we do a C-section, my mother in Nepal, and she's got to trek for 2 days to get to the medical facility again, because they're living in rural villages, she's at risk from rupturing her C-section scar. So we push these mothers very, very hard to get them through labour. We really don't want to be doing C-sections on mothers unless we have to. As far as when they're in labour, we give them a little bit extra. Because if we do a C-section and they're walking across, and that their uterus can rupture and they lose their life as well as the baby. Sorry, you were going to ask me a question.
I was going to answer the video, but my sister got it for me.
Oh, what was it?
The video name?
The video name.
Yeah, but my sister
found
found it.
Okay, great. And then I got this for you because I know you were asking about twins. I just wanted to kind of make it easy. So identical twins, monozygotic. That's one fertilized egg, but that splits within 3 days. I couldn't remember the exact day, but it's within 3 days, and that's one placenta, and 2 placentas. So let me see, identical, let me see, 2. Oh, and monochronic is the single. They split after 4 to 8 days. Yeah, twins come split, so if it splits within the first 3 days, each twin will develop its own placenta. If it splits after 4 to 8 days, the twins will share a single placenta. If it occurs very late, after 8 days, they may share an amniotic sac. It's a bit like rental. Okay, yeah.
So would it be the same for triplets and quadruplets?
That's a good question. Let me look into that. I can't remember. I think so. I think that they'd probably get their own placenta. And we would deliver the babies first and then deliver the placentas. The reason why, if I did try to deliver the placenta, it could be attached to the other placenta, and then I could rupture that placenta.
The placenta doesn't come out by itself.
So what you're seeing there is you're seeing a twin delivery. Let me see if I can get a single vaginal delivery for you. So you can see a single delivery now.
Because I've heard the situation where they operate somebody to bring that person.
Okay, this is a single delivery. Let's see. This is. Let's see. Sometimes I like to rupture the membranes, because if you rupture the membranes when the baby's head comes out, it doesn't take that big breath, because once the baby comes out and it's tight around the vagina, it's actually squished, it's squishing the lungs, and then when that baby's delivered, it takes a huge breath of air and goes, and any so if a placenta, we're going to give the mum 20 minutes.
Okay.
So what's going to happen is, with a pretend placenta, I'm going to deliver the baby, okay? And then what's going to happen is if the placenta won't come down and present itself in the woman's vagina, I might unclamp this and let some blood out.
Okay.
And then that will just give this a little bit more room. Usually what happens, ideally what happens is once the baby comes out, the uterus goes a little bit smaller, and that means that this is kind of shorn off the uterine wall, and then it kind of goes blip and then plops down. Now if this is stuck, placenta accreta it's called, where it's stuck to the uterine wall, we have to go to the operating room, and a surgeon would go in vaginally and would scrape this off the uterine wall. She would probably be given a spinal, but he might do a pudendal block, which is he would numb the area below.
What if they were like they had placenta previa? I think.
Yes, placenta previa. So placenta previa is where we have the placenta is either. Remember we did that diagram before, and I'm going to go over that because that's like a complication. That's next week. But placenta previa looks like this. So we have 4 different types of placenta previa. So if you imagine this, if I would do this 4 or 5 times. Oh, I'm so great. Okay, so placenta previa. Placenta hopefully is here, but it could be here. We'll see it on the scan. It might be a low-lying placenta or a complete grade 4 placenta previa, and there's no way that baby's coming through there. We are a C-section. We are probably a C-section if it's low-lying. This, because of the delivery, is probably going to come unattached, and so that's a high-risk pregnancy. So hopefully, when we do the scan, we see the placenta is high. If she has some fresh bleeding, sometimes that can mean that the placenta is low-lying. So once the baby is out, and in a normal situation, I'll see this, I'll twist this around my fingers, and I will give it a gentle pull. I'm not going to pull it too hard because I don't want it to, if it's stuck to the uterus, I could involute the uterus, I could pull the uterus out, or a bit out. I mean, I'm not going, it's not being pulled off and then running off to target. It literally just gets involuted. It kind of comes out a bit, and that's an obstetric emergency, so we've got to be very careful. So I would wait, sometimes we see a trickle of blood, I would wait, and then I would guard her pelvic region, and then I would very gently ease this out and have this delivered. But if it doesn't come out, it's called retained placenta. I've got 20 minutes. 20 minutes, I'm on the clock to get this out. There is an acupressure point on the foot. I remember I worked with an amazing midwife, and she used to do acupuncture points on the foot, but it wasn't within, protocol. She would just kind of do it on the slide and get the placenta out. But we didn't talk about that because, of course, if the woman has a hemorrhage, then that's not good. She'd be blamed, it wouldn't be her fault. Because, over thousands and millions of years, we've probably been doing all sorts of tricks. I heard that there's a herb that can give women contraception for up to 8 years. Yeah, but it's a rare herb. In some countries they use. I don't know which country, but so with drug companies probably don't want us to know this. Anything? Oh, did you? Yeah.
I used to be confused trying to.
Yes, that's my job. That's my job. Bring me the confusion.
Trying to correlate the human birth with animal.
Right. Okay. We've got veterinary nurse. Well, this might be one for the veterinary nurse, but we'll work as a team.
An animal can give a birth to about 15, like pigs.
Yes.
Can give birth to 15.
I don't know. I've never looked after a. But
It depends on the breed.
Okay. Depends on the breed of animal, right?
Species.
What
Are you talking
species?
about dogs, or
He said a pig.
What confuses me
Yes.
is that for human being to give birth to 1 or 2, the complications are too much.
Oh, it's the same in animals, isn't it?
Without the medical assistance.
They can have complications just like.
But they don't have medical assistance.
They do. Well,
Etiosha is there now.
Some women have babies without medical assistance. If it just happens all of a sudden and they go into
deliver in a
labor.
car on the way to
It's
hospital.
just sometimes it happens, sometimes it don't. Just
So
like
what
animals,
you're
they
saying
die,
is
babies die.
we're bringing all the bells and the whistles. We're bringing in the oxytocin. We're bringing. What you're saying is what did we do hundreds of years ago when we didn't need all this? babies were more likely to die, mothers were more likely to die, mortality rates were higher. In certain countries, babies and mothers are more likely to die than in America, but we still have deaths. So what you're saying is why, basically, it's still dangerous, but it's safer than it ever was. Because we can monitor externally. One sign the baby's got distress in it, we're off for a C-section. So, does that help?
And we get calls of like, we only see dogs and cats, so we get calls that a puppy's stuck, or the mom's been laboring for a whole 2 days and still no babies, or there's like extensive bleeding. Like they have emergencies too and they have to rush them in, but owners tend to wait until, you know, they see something wrong. Otherwise, the moms you just make sure they're warm and they kind of do their own thing. But if you notice something, then they do take them in so the emergencies do happen. But they're just like, I guess they're born with some sort of intuition that tells them what they're supposed to do.
Right.
Because a lot of times they do it.
And once the baby starts sucking at the mother's nipple, that helps with the delivery of the placenta, doesn't it?
I don't even know if dogs have placentas, to be honest.
Yeah, they do, because they start eating it.
Our dog,
As soon as she gave birth.
I've never worked in like a surgical facility.
That was already.
Like,
I don't know, I'm just
guessing.
guessing. I'm just making a wild guess.
After the fact.
Confuses me
Yes.
that for human being to give birth to one or two, the complications are too much.
Oh, it's the same in animals, isn't it?
Without the
it?
medical
It is.
assistance,
They can have complications just like.
but they don't have medical assistance.
They do, well.
Etiosha is there now.
Some women have babies without medical assistance. If it just happens all of a sudden and they go into
deliver the
labor.
car on the way to
It's
hospital.
just sometimes it happens, sometimes it don't. Just
So
like
what you're
animals, they
saying
die,
is
babies die.
we're bringing all the bells and the whistles. We're bringing in the oxytocin. We're bringing. What you're saying is what did we do hundreds of years ago when we didn't need all this? Babies were more likely to die. Mothers were more likely to die. Mortality rates were higher. In certain countries, babies and mothers are more likely to die than in America, but we still have deaths. So what you're saying is why, basically, it's still dangerous, but it's safer than it ever was. Because we can monitor externally. One sign the baby's got distress in it, we're off for a C-section. So, does that help?
And we get calls of like, we only see dogs and cats, so we get calls that a puppy's stuck, or the mom's been laboring for a whole 2 days and still no babies, or there's like extensive bleeding. Like they have emergencies too and they have to rush them in, but owners tend to wait until, you know, they see something wrong. Otherwise, the moms you just make sure they're warm and they kind of do their own thing. But if you notice something, then they do take them in so the emergencies do happen. But they're just like, I guess they're born with some sort of intuition that tells them what they're supposed to do.
Right.
Because a lot of times they do it.
And once the baby starts sucking at the mother's nipple, that helps with the delivery of the placenta, doesn't it?
I don't even know if dogs have placentas, to be honest.
Yeah, they do, because they start eating it.
Our dog,
As soon as she gave birth.
I've never worked in like a surgical facility.
That was already.
Like,
I don't know, I'm just
we
guessing. I'm just making a wild
see
guess.
this after the fact.
Yes, of
Because we don't
course.
do like specialty
You don't
sections
do
and
the
stuff like that.
deliveries. 'cause
Yeah,
it's not
so I
hard.
mean, I'm assuming they do because how else would the baby get nutrition? But
And what do they do? Do they eat it?
Yeah,
Are
they
they-
eat it. They always eat it.
They eat their placenta. Now, we
They
could
eat their
the
placenta?
but we
They
don't.
eat their placenta.
We hope
I know the dogs.
Krista, do you say they eat your placenta?
Yeah.
But yeah,
Oh, the Kardashians.
Can I go?
The Kardashians always cook their placenta.
They can't even cut a cucumber. I doubt they're eating their placenta. I think it's just for
Krista, I don't know where she got it from.
I saw a video on TikTok. She took her placenta home and her chef.
Now, you can do that. You can take your placenta home and cook it up and eat it. Now, couple of we just talked about that. Now, in all honesty, it takes.
Well, like in Africa, they give it back to the
nutrients,
woman
it
to
takes
take.
toxins away.
To do what?
I don't
They
know.
go bury it in their compounds.
But you can also take it home and plant a tree on top of it, which I think is super sweet.
They do that in Africa, though.
And there's sometimes, and in
Yeah.
sometimes, and then sometimes, yeah, because there's lots of iron in My concern is, well, some hospitals' protocols forbid you taking the placenta home. They're like, no, because of cross-infection, it's a blood product, it's
Yeah.
in a red bag, so it's something you would have to discuss. So that's just something that's interesting. But thank you, thank you for sharing that. But yeah, sometimes it's a trend, you take your placenta and you cook it up and eat it. But the thing is, if you think about it, your body can only absorb, so many nutrients in one go.
Right.
So let's just say you could only absorb so many grams of iron, you might as well get that iron tablets.
So when you do the cord banking, is it just the cord or along with the placenta as well?
The cord banking, I think you send everything.
With the placenta?
Yeah, I think you send everything.
To plant
We
orange
don't
and all
separate,
that.
I've never separated the cord.
Not the placenta. They use the.
Krista,
Krista, do you say they eat your placenta?
Yeah. So
But
I
yeah,
don't
I
like my
like
ears.
Oh, the Kardashians.
Can I go?
The Kardashians always put they cook their placenta in the
They can't even cut a cucumber. I doubt they're eating their placenta. I think it's just for
Krista,
babies.
no, she got it from.
I saw a video on TikTok. She took her placenta home
And
and she
her
ate it.
shell.
Now, you can do that. You can take your placenta home and cook it up and eat it. Now, a couple of we just talked about infection. Now, in all honesty, it takes.
Well, like in Africa, they
gives
give it back to the
nutrients,
woman
it
to
takes
take.
toxins away.
To do what?
I don't
They
know.
go bury it in their compounds.
But you can also take it home and plant a tree on top of it, which I think is super sweet.
They do that in Africa, though.
And there's sometimes, and then
Yeah.
sometimes, and then sometimes, yeah, you can, there's lots of iron in here. My concern is, well, some hospitals' protocols forbid you taking the placenta home. They're like, no, because of cross-infection, it's a blood product, it's
Yeah.
in a red bag, so it's something you would have to discuss. So that's just something that's interesting. But thank you, thank you for sharing that. But yeah, sometimes it's a trend, you take your placenta and you cook it up and eat it. But the thing is, if you think about it, your body can only absorb, so many nutrients in one go.
Right.
So let's just say you could only absorb so many grams of iron, you might as well get that iron tablets.
So when you do the cord banking, is it just the cord or along with the placenta as well?
The cord banking, I think you send everything.
With the placenta?
Yeah, I think you send everything.
To plant
We
orange
don't
and all
separate,
that.
I've never separated the cord
Not
from
the placenta. They use the navel, not the placenta.
And then they would do that. They
The
would
navel
do
of the
what
child.
they're gonna do. Take-
As in,
they can
when
also,
need
the
the
other thing
fork.
I can do is I can take
That's what they
blood
use
from
holding
this
this, not the
cord,
placenta.
alright? For example, the mother, we'll go into this next week, the mother is rhesus negative. I'm A positive, but if I was rhesus negative and my husband was positive, my partner was positive, and I would take some blood from this cord, I might take it anyway, send it off to the lab, it'll tell me what blood type the baby is. This is the baby's
You know
blood
the
in
story.
here. This is the baby's blood, and I would be able to figure out what cord blood I have on this. Cord blood. So you remember that now, because she was waving around the cord. And it should have 3 vessels, 2 arteries and a vein. What I love. Okay, let's watch another delivery. You did great. These are amazing questions. Also, because I love you, I'm going to put the screen
You sure say I go feed you nurse? Oh, great. Yeah. I'm not going to figure this one. No. I can do one nurse, but I don't feel Victor,
Say push and push, push, push. He's going to say stop in a minute when the hip cramps.
When you were What difficult
Of course. Me, growing up, I thought it was the tear this time.
They're drying the baby up for me.
Guys, I'm on break now. I'm going on for break. So we have 2 hours break because our class is usually 12 hours class. So we're going for break now. I'll keep updating you guys on how we do it. It's so on break. 2 hours. Guys, I'm on break now. I'm going on for break. So we have 2 hours break because our class is usually 12 hours class. So we're going for break now. I'll keep updating you guys on how we do it. It's so on break. 2 hours.
The first layer of stitching by pulling the uterine layer around it, and then it hides it, and it gives it a second straight layer. So that's called a 2-layer closure, which is our normal layer closure that we have for a
That's stitching, huh? See?
This is chilling right now. It's all right.
Jim's been over here, looking good. This side, that looks good on that side, Jack. We're done. Okay, let's put the uterus back in. Okay. Close. I'm going to take the retractor out. And I'm going to close this all in with one big layer. Vessels and make sure we're fine. All right, we'll close now the fascia layer. Everything's fine up here, Dr. Hash. It went great. Uterus is closed.
Baby's big.
Yeah, no kidding. He was. You didn't get some credit for that. There's a closed motion. And we will not have any staples or anything to take off. It's all underneath the skin. Congratulations. Boston's court. Thanks, everybody. I know, right? Hello, you, Boston. Oh, my goodness, what a good job still.
Very happy. I'm glad Mama's doing okay. Hey, tell me why.
Here, we'll be checking on your vitals for the next hour or so. When everyone is ready to go, we'll move you directly to your postpartum, where you'll be for the next 3 or 4 days. Okay, let's see. Can you move your legs now? No, move your toes. Okay. So I'm going to put your head up a little bit. When I put your head up, if you feel nauseated or dizzy or anything, tell me to go. Okay? Any questions for me? Which way start you see? Right.
Oh, start breastfeeding immediately. Women are trying. Women are trying. Women should be respected all over the world. Women.
It was not easy. Staff was really helpful.
very sleepy. They're so happy. They're so healthy. I think that was the biggest thing, having a healthy baby at any ages. Especially when they're older. It's really cool.
I think that was the dad. Right? Her head like that. Huh? Yeah, I think that was the dad.
So this is a C-section, still on the process of maternity newborn.
So I'm Dr. Sounds like they were able to get my IV, so I'm gonna take a look and see if I can help out there.
So I'm gonna do this one.
Okay, right here. So I'm on 3 minutes, ready? Is it now? Ready? 1, 2, 3, big push. 3, 3, 3. Turn, turn, turn. Forward. Push back, slow down. Deep turn, good. Okay, good. It's all right. That's it. That's it. I'll just hold this up this point. That was busy. So there's no more needle in there, okay? Take deep cleansing breaths. This is just a nice big press in the body of this. Let your body get go anywhere, okay?
It's a little cold in here, Alicia. But that little step definitely more.
No surprise. Okay? You know what's been happening this time? Okay, lots of cold. Still on the back, okay? Get a tank up on you, okay? Okay, another drape on your back. A little bit cold, a little bit sticky. Honestly, your job right now is to just focus on becoming more and at that point, nothing else really gonna matter what's going on. Does that feel like you're pushing right over the bones of your back? I'm gonna push right over your spine. Perfect. I'm gonna push
Is this a spinal or an epidural?
You're gonna feel that on the